Let us look at nutrition in the elderly. What are we looking at here? We know that the elderly actually face different challenges. Challenges to do with how they carry out self-care, okay? Whether they can be moving uh, alone without help to the showers, be able to change their own clothes, be able to cook their own food. Some of these are challenges that the elderly will face. And that therefore means that they will have unique needs. And in addition, they will have unique needs as concerns their feeding. Why? Because some of them may actually be having dental problems. That's one. Two, they can be having problems to do with chronic diseases, diabetes, hypertension. These are problems that are linked to the diet, and their management requires proper diet planning. Okay, so among the other nutritional problems that the elders can actually face, what do you need to know in order to be able to care for the elderly in terms of nutrition? So we start by looking at this scenario. So what we are having is James, who basically lives with his 78-year-old grandmother. And the grandmother has been complaining about frequent fatigue, dry skin, constipation. She has no teeth. She has lost all the teeth, and it is very hard for her to chew the food. Okay, James wants to ensure that she receives proper nutrition. Okay, so when we talk about proper nutrition for the elderly, what is it supposed to be containing? Now, if she does not have teeth, how do we make sure that she can actually eat? If she's feeling constipated, what do we need to give her to make sure that that constipation goes away? Okay, and then the other thing is about fatigue. What is causing this fatigue? So these are questions that we need to address through this session. So nutrition is still very important, like in all other age groups. It's very important in the elderly. What usually happens is that if someone is aging well without all these complications, they can be on the usual diet. Okay, but if they have problems that affect their nutritional status, or that will influence the foods that they need to eat, then we need to take into consideration um, certain points on which foods they need to eat. But when we talk about the elderly, we are referring to individuals that are between 60 to 65 years until perhaps they die, whether 80, whether 90, or sometimes 100. The needs that they have are not only nutrition in nature, they also need to be loved. So they need to have people around them, and that is the component of social interaction. They may not do a lot of exercises, but this can also still be very important, and they need to have a regular, balanced diet. Okay, so like in our scenario, uh, James's grandmother is having problems related to nutrition. Constipation, when someone is passing hard stool, okay, very small stool, very hard, that means that this person is not having sufficient fluids, is not drinking enough, and also it could be an issue to do with lack of fiber, dietary fiber. Okay, the other problem that they are, the case is having, or the scenario is the issue to do with lack of teeth. That means that this grandmother needs to feed on soft foods. Okay, the other challenge that we can see in the scenario is an issue of fatigue. So why is she easily getting fatigued? So these problems can be shared by other elderly individuals. Um, like I said, they can have medical conditions. It is they can have hypertension, diabetes, heart diseases. They can have osteoporosis. If they can have low immunity. They can easily be malnourished, especially undernourishment, and then they can have anemia, anemia, obesity, and then osteoporosis. These are common nutritional problems that they can actually face. Okay, so if they have swallowing problems, what do you actually do? What do you actually do? When swallowing is associated with the ability to chew. If you can't chew the food properly, it's going to be difficult for you to be able to swallow it. So what that basically means is that if you have an elderly who has lost their teeth, it means that you need to organize for them nutritious foods that are actually soft. Liver, uh, eggs, these are easy foods to basically chew and swallow. Okay, so avoid those tough foods. Okay, tough foods can actually also reduce saliva production, and saliva production is actually associated with difficult swallowing. So you don't want to be in that situation. So in aging normally is associated with the physiological changes. Your body cannot perform as if you are still young. So when a person is actually growing older, their body is also getting tired, if I can say. So they will have problems with digestion. Digestion will be slow. So when we talk about this absorption of nutrients, metabolism, even excretion, these will actually be very slow processes. But of course, these changes can come either early in life because some people uh, can be appearing older, yet they don't have many years. Okay, so this can be influenced by whether they have been active in their life, can be influenced by genetics, can be influenced by socioeconomic factors, or even having a particular disease. If someone has a particular disease, it may be and that disease can dilapidate them, okay, such that their body basically weakens even when they don't have very many years. So all these things will actually influence how these people will be aging and the nutritional needs that they will basically be having. Okay, and then other changes that will happen to among the elderly are issues to do with sensory perception and physical changes. Of course, some of them may not feel they may not uh, they may lose their sense of smell, their sense of taste, their vision. They may not be seeing properly. Okay, they may actually also be having diminished thirst and diminished hunger. That means that even when their body actually needs water, they may not feel that thirst to actually get that water and drink. So these sensations are not acting as they should be in the elderly. So they are diminished performance of sensory cells. And that's why it is very difficult for their bodies to get to that. And then we have issues of muscle loss. They waste, they become smaller. And then you have increased body fat, uh, height loss, and then reduced mobility. they don't usually move a lot because they don't really have that energy to do a lot of exercise and move around. Okay, so that also means that the activities they're supposed to be engaged in are supposed to be very light activities. Osteoporosis is something that we talked about earlier on, and is when you have loss of bone density. Okay, you have the digestive, almost every system slows down. The nervous system, that's when they can't remember things well, they can go into dementia and things like that. The digestive system also slows down. Digestion becomes very hard, and then you have constipation and malabsorption. The heart, the kidneys, the lungs, all these, they don't function optimally. Okay, so they slow down in terms of functioning. Okay, and then like we said earlier on, they do not only need nutritional care, they also need what we can term as social and social and psychological care. So they need to be with people, they don't need to be isolated. There should be long-standing food habits, also issues to do with avoiding misinformation, and then issues to do with depression and anxiety can actually affect their intake. So that means that you have a lot of factors to look at if you're looking at an elderly client. Social factors, if they have gone into retirement very fast, they don't have a stable source of income, they are not likely going to be able to afford the nutritious foods that they actually need. So that means that they will always depend on other individuals. They have multiple conditions usually, and they are therefore taking many drugs. So the nutrients that you're giving may also have an impact. Okay, the other thing that you also need to consider, how is the food being prepared? That of course influences the texture of the food. And there, what do you need to do for these patients? One, ensure that they have sufficient protein, sufficient calories, they hydrate sufficiently, and make sure that you give them soft foods if they have swallowing and chewing problems. Okay, interact with them more often, and make sure that you have varieties of food. Remind them or create a schedule such that, or what we termed as diet habits, such that they actually know when to eat and they can actually be ready for the meals. Have small, frequent meals. These are encouraged. You can encourage them to exercise, not too much exercise. It can be as simple as walking or even swimming if they can. I think that's covered. If you might need to modify some nutrients if the foods are actually having high nutrients, then you lower the intake. For fats, reduce saturated fats, and then give them dietary fibers to improve their bowel health. Give them proteins for muscles, and avoid excess protein. That's very important. Make sure that you give them vitamins and minerals, either as supplements or in the usual foods. That could be vital. Okay, so in terms of vitamins and minerals, focus on iron, zinc, vitamin E, calcium, vitamin D, vitamin B12, and then you need to know the functions of all these. Yeah, so coming back to our scenario, I guess we have covered every aspect of this question in terms of nutritional concerns in the elderly. We can point them out. What James can do, we have already looked at that. Very many points there. And then the fiber will improve on bowel health, basically preventing the constipation that we are talking about. Again, even the water will prevent the constipation that we have in James's grandmother. And then, of course, given that these elderly individuals need social interaction just like any other individual, it could be important to promote these nutritional practices to the community members such that they know what they need to do when they have an elderly person